Peter, I'd like to discuss with you a patient that we recently managed that was bitten by a puff adder that had a very interesting outcome. It was a patient that basically came in and was bitten. We were both involved in the case, and I initially advised that the patient get 4 vials of polyvalent antivenom. The patient was bitten on the hand and had a very swollen hand and arm. Do you want to take us a little bit further about what happened after that antivenom administration?
I remember the patient very well. So we had given 4 vials of antivenom. A few hours later, the arm was still extremely swollen and tense, and something clicked that said this is a pseudo-compartment syndrome, and so it was an indication for more antivenom. So we were fortunate enough to have our ultrasound machine on standby, and we managed to look with the linear probe into the compartments on the affected arm and the unaffected arm and see that subcutaneous layer was very, very swollen. It was in fact double the size of the unaffected side. And so that was an indication for more antivenom. 2 hours later, we measured the compartments again using ultrasound and administered another 2 vials of antivenom. And that helped so much, and the compartment sizes went down afterwards.
Just want to go into that a little bit. How did the muscle compartments compare on the 2 sides?
So on the affected side, the muscle compartment was just slightly more hyperechoic, which means bright on ultrasound, and that's a sign of inflammation. Probably from the overlying inflammation in the subcutaneous tissue, but the size itself was the same on both sides.
Okay, so I think some important points from this was that pseudocompartment syndrome actually don't need a fasciotomy necessarily, number one, because I think this patient was almost taken to theatre for a very invasive procedure, which turned out wasn't necessary. Secondly, I think it's important to point out that aggressive antivenom administration, additional vials above maybe your typical dose of 4 vials, maybe 6, 8, 10, 12 vials might be necessary. And I think lastly, aggressive elevation, and as you then said, another thing would be the use of ultrasound.
Absolutely.